Okay, looks like we've leveled off. Um, Thank you all for joining. This is Dr. NAACLS, of course, and we're focusing today on updates from the April 2023 meeting. We're recording this on June 21st, sorry, 2023. And the reason we timestamp these is because our compliance requirements can change at least twice a year, usually after a board meeting. So if you're seeing this at a later date, or if you found this, 3-6 months down the road, and you want to confirm that some of the compliance issues we may discuss during the Q&A are still accurate, I encourage you to go to the website. That's where all the most up-to-date documents are. Or, of course, you can just contact staff. The team today is our NAACLS Board of Directors President, Dr. Maribeth Flaws, and then myself. My name is Mark Spence, and now I will hand it off to Maribeth.
Thanks, Mark. Thanks for everybody being here. I really appreciate it. So this is an update on some of the decisions that the Board of Directors made at our April 2023 meeting. One of the changes is we shortened the time that you have to submit a request for us to review a decision. So this would be if you've gotten a decision about your accreditation that you don't think is appropriate, you have 21 days now to ask us to review our decision and appeal the decision instead of 30 days. We find that most people, when they get a decision they don't agree with, are going to respond right away with their displeasure or reasons why that they don't think that it's fair or true. And because of the timing and communication in between a review committee meeting and a board meeting, it's a short time frame, so we need to get the appeal process running as soon as possible. So note that you only have 21 days now to appeal a decision from the review committee before it goes to the board of directors. We also decided to change the fees that are being charged. So when you are up for a site visit, the administrative fee will now be $750. So just like everything in your personal life, costs are going up. So you will see a charge of $750. I guess the good thing now is, you only have a site visit every 10 years. So you're not paying an increased fee every 7 years, perhaps. But note that there is an increase in that administrative fee for scheduling site visits. All right, self-study reviews and interest in serving on a NAACLS review committee. Because the job of the review committee members is reviewing all of the self-study documents, the self-study report, the site visit report, when you serve on the review committee, you need to be comfortable looking at all of those documents. And so if you've done them before as a volunteer, that will weigh heavier when you apply to be a review committee member than if you've never looked at or done a self-study review before. These are really important reviews because it gets the whole review process started. It gives the site visit reviewers an idea of where the program is with regards to compliance to the standards. It does take a fair amount of time to be thorough. And so that skill and that experience is really important as a review committee member. And I hope that a lot of you are thinking and looking to the future and thinking about, I'd like to be a review committee member because it's really a rewarding and educational experience. So next slide, Mark. We are in the midst of revising the standards, and the public comment period just recently expired, and we got lots of comments on the new standards as proposed, and we really appreciate your feedback. It gives us a more well-rounded view of what the profession looks like, and it helps us understand your limitations. We are going to consider those comments. The review committees meet in mid-July, in about a month, They will look at the comments. They will have some feedback kind of generally. The board meets in September. They will also look at those comments, and we will incorporate the comments or make changes or as appropriate. We're still looking at an extended timeline for adopting new standards and making them effective. And rest assured, you will have enough time to change operations or to add things so that you will be in compliance with those standards. But we're still in that process, and we really appreciate your feedback in the process. Okay, next slide. We have a couple of task forces that have just been started. We have Inclusion, Diversity, Equity, and Access Task Force, and they're just getting started. If you have looked at the revised standards, there's quite a bit of language around these idea concepts, both for treatment of students and faculty, but also of education of the students. And we got a lot of feedback about how people felt about that and how they'd be able to implement some of those ideas into their programs. And that was probably one of the changes that got the most feedback. And we're going to be considering it. And we're going to put that toward this idea task force to consider. But this is something, so NAACLS is recognized by the Council on Higher Education Accreditation, CHIA, and one of CHIA's standards that NAACLS has to comply with is regarding IDEA, and that NAACLS will have not an emphasis really, but some attention toward these aspects that CHIA feels that it's very important, as do a lot of people. But as we found in the public comments, there's a lot of debate about this across the country. So this is not going to be an easy fix or change, I think. All right, next slide. Our other task force is related to international programs. So part of our mission is to be the premier agency for accreditation of, and Mark, we have a new mission, actually. It got rewritten, and this slide has the old mission. But in our mission, it includes that we are about the education in the clinical laboratory sciences and related healthcare disciplines nationally and internationally. So this task force has been established to look at, how are we going to increase our brand internationally? What does that mean in terms of our standards and our operations and all of that? So kind of an exciting time, I think. All right, next slide. So standard one sponsorship gets a lot of discussion, and right now we have 3 recognized sponsorship categories. There's been a lot of debate about what those categories mean, especially when it comes down to the multi-location programs and the consortia programs. So we have a task force of the board who's going to look at this and try to change the language so that, one, it's clearer and everybody understands it, from NAACLS staff to volunteers to program directors, and 2, to have it reflect what is going on in the education models today. So look for some change. So this sponsorship change, there will be additional changes. This was not part of the standards that went out as a group for public comment just recently. This is going to be discussed some more, and we will again, if we do revise this significantly, we will send it out for public comment again. Have no fear. So I think that is it that I have prepared comments. So we'll open it up for questions.
Yeah, these questions can go directly to some of the items we discussed today, or obviously people are probably in the middle of site visit season or self-study season. So standard compliance issues are also on the table. I would like to point out the people you see now are currently serving as our DLP. DLP stands for discipline lead person. These are current review committee members that part of their responsibilities are to answer questions anybody may have about standard interpretation. If you have something more process driven, please contact staff. And just a quick note about their responsibilities. They're not necessarily there to give a once over for an interim report or a progress report to try to get an idea of how the review committee may settle. We don't want to overburden them. They are volunteers and they're very generous with their time, but they're more than willing to assist if you have very specific questions about a standard compliance issue. And this also serves as a reminder to we definitely want to thank all of our volunteers, whether you find the time to graciously do a self-study or two throughout the year, or obviously those review committee members and board members who have more responsibilities and are willing to commit their time and expertise. I see a few review committee members on the call right now. So yeah, if you're listening now or in the future, thank you for your contributions to the organization. If you do have a question, you can put it in the chat or raise your hand, and we can handle that. We don't have any right now, so I know it's the end of the day, so we all just may be ready to log off, but I'll give it a couple more moments. Oh, we do have something in the chat. 1 second. Oh, the chat's disabled. The chat may be disabled, but the Q&A is not disabled. Thank you for pointing that out, Marianne. I kind of use those terms interchangeably, unfortunately. So if you do enter a question into the Q&A section, we can see them. What is the time frame we are looking at for the new standards?
Yeah, good question, right? So we were hoping to review all of the public comments, have the review committee consider those comments, and then make changes in what we had proposed for the standards, submit that to the board of directors to vote on in September. And in looking at all the comments, we realized that that would be really rushing the whole process and would not give us the time to seriously consider all of the comments we got. And there's, as you all know, and what I like about this profession is the flexibility that we have, and there's all kinds of different options. So we really need to be thoughtful on this changes and consider how it's going to affect everybody. So we've got, it'll probably be then at least at the earliest now, it would be April of 24 board meeting where the new standards would be approved. But then we would give you, I don't know, Mark, 2 years to come into compliance. Like they wouldn't go into effect.
Yeah.
For probably 2
So,
years.
Yeah. So what has to happen after the standards are done is then we need to develop compliance language for the new standards. So that would take at least 6 months. So if I had to guess unofficially, if they would get approved in April 2024, if we could get the compliance stuff done by September 2024, which would be a hustle, we would then send out notifications of renewal for self-studies coming in fall of 2025. So we're looking at 2025, I think at the very, very earliest before we would be accepting self-studies under the new standards. So again, with the caveat that the board hasn't had these discussions explicitly about how to handle this, but we've had internal discussions, and just kind of the way NAACLS has done business in the past, where we haven't previously done like reports to ask how are you in compliance with these new standards once they're immediately changed. We respect the awards that everybody has earned. Your award is your award. We're not going to change that. And we want to make sure that we give at least the year ahead of time for programs that may be starting to do self-studies. So obviously there's a lot of things to consider, and we have been definitely focused on the amount of thoughtful feedback we've gotten at this point. So a lot of the details of the next step, we just haven't prioritized yet because we're focusing on the things that need to be focused now. But to give you a very rough idea about when we would be looking, I think it would be fall 2025.
Right. So the biomedical scientist standards, so these are new. NAACLS is trying to increase its reach into other types of laboratory science educational programs. So those standards are related to that. I'm not sure exactly what you mean, what you want elaborated, or if Mark wants to say more.
Yeah, hopefully I just don't repeat you, Mary Beth. To be full disclosure, I was kind of reading ahead. Yeah, the idea with the biomedical scientist standards is that we are getting contacted by programs offering certificate or degree-based courses or degree programs, to be redundant, in these really, really new emerging careers. And there may not be they want accreditation. There may not be enough to kind of form their own kind of discipline and subset of standards, as there are with the new microbiology ones we just approved, or the public health medicine. But if people want accreditation, we definitely want to encourage them. And also we want to show that those programs have value. So the biomedical scientist standards are kind of umbrella. It's a way to kind of start these accreditation process with these emerging programs. And then if we get a point to where there's enough in a specific discipline, we can focus more on those discipline standards. So hopefully I just didn't repeat exactly everything you said, Mary Beth. If new certification level is adopted for the MLT program director, could that be implemented sooner? Suzanne, I assume you're talking about some of the changes in the new standards. Again, Mary Beth, please correct me if you see this going a different way. The board hasn't had these discussions yet. I would be surprised if the board would do these in piecemeal. I think we want to kind of take these as a whole change, just so everything is easier with the training and the education we may need to develop and the compliance language we need to develop. So if that changes in September, obviously that'll be part of the September board report. But if I had to guess right now, that's kind of where I'm leaning.
Yeah, I agree with you, Mark. It's hard. And NAACLS reviews the standards all the time, especially as we get questions from program directors and review committee members who are seeing problems with compliance and a lack of understanding about wording of a standard. We're always looking at them, and then we'll tweak a standard here and there. There's always time for public comment. But I think at this point, since we're putting all of this into one package, I think we're going to keep it as a package. But maybe we decide, okay, if some standards are less controversial, maybe we could implement them sooner than some of the ones that have generated a lot more discussion. I don't know, but I'm not sure.
Yeah, I think that's a fair assessment. If we change the program name to MLS, do we need to notify NAACLS? Honestly, I would need to review Standard 6 to see if we specify that about. I don't believe that's in there. If your college or university's names change, we would obviously need to know that. I don't think that's in there. I want to emphasize think. Please feel free. I mean, if you look at Standard 6, which is our administrative standards, and it's still kind of unclear, please feel free to contact me off this call where I can look at the standards. Those of you who have asked me about standards, before I've been here 20 years. I'm still very hesitant to try to quote the standards when they're not directly in front of me, because I've already gotten into trouble doing that way back when, and I learned not to do that again. So I don't mean to put you off, but look at Standard 6, and if you're still unclear with it, please feel free to email me or call me.
Yeah, and I always get a question from my dean, when we make a change like to our calendar or something, do you have to notify your accrediting organization? For some accrediting organizations, they want to know if you've moved your office. I mean, maybe not that specifically, but they want to know the changes in minutia. NAACLS is not like that, but it doesn't hurt to send an email to info@naacls.org and just say, hey, we're changing our name, just in case. But Mark's right, just check standard 6 because that says specifically what you do need to let NAACLS know about. And it's not as much as other accrediting bodies.
Suzanne had a follow-up to the approval question. What she meant was if the board approves the change and someone is in place, can the new person be approved sooner than fall 2025? Again, stating we haven't had that discussion explicitly, I can say historically, if NAACLS has made standard changes that make programs' life easier, we will let you operate under those standards sooner. If it's something that we think is, may take some change on the program, things may be altered to take place, that's when we want to make sure we give you enough time. But for example, when we changed the standard that for the clinical liaisons to not be certified in their discipline for programs that had those progress reports because they were found non-compliant with the previous standard, we just wiped those progress reports and we didn't review them because there was no need to make their lives harder on a technicality. So we do try to operate like that and try to accommodate programs if possible, but we haven't had those explicit discussions, so I can't give you a definite answer. If an MLS program, college-based affiliated with a hospital, and now we want to make it a 4+1 program, do I need to start over with an additional accreditation or just update the program that's already in place?
So you already have, you're already an accredited program. What I've seen a lot of schools do is they have multiple tracks, but what we'll do is accredit your program. We don't accredit specific tracks. So you wouldn't have two separately accredited programs. It would be all as one, and then you would have to show the progression of students in this track versus this track, and that all of the students and all of your operations comply with the standards. So I hope that helps.
Good questions.
Yeah. Mm-hmm.
We've got an opening if anybody has one. All right, seeing none. Thank everybody who jumped on to, yeah, it would be under your award, Mary DeLise. I hope I pronounced that right. I'm sorry if I didn't. For things like this, if your next report, or if you come across something that says, has your program went through any significant changes, this may be something you want to mention. And I just listen, and Maribeth may have more information on this. I would definitely be prepared to assess these changes and show those when we ask you about your program assessment. But as far as like specific paperwork just for this change, we don't have it. And this is just listed under your university or college. As Maribeth said, we don't specifically say this part of the program's accredited, this part of the program's accredited. The program's accredited, and if you want to change and evolve and add delivery methods, you're free to do so without a lot of NAACLS meddling, for lack of a better word.
I like that word. And I really like that you are being flexible and responsive to the needs of your community, right? Because that's what I'm seeing you're doing. So I definitely encourage that. And what I like is that NAACLS is not going to meddle in all of those processes.
Yeah, our volunteers are busy enough. They don't need extra work for reports that may not go a long way to demonstrate program quality, in our opinion. So I'm not seeing any other questions. If you have more, please enter it, but I'll start wrapping it up in the meantime. Thank everybody for attending. Thank you for the good questions. Thank you for my patience when we couldn't, or thank you for your patience when we couldn't give you specific answers to questions that I understand are very, very important. Gia goes through standard changes themselves. I know the anxiety that can create. Honestly, the anxiety that creates informs a lot of my opinions about how NAACLS, I think, handles standard changes better. Sometime at CLEC. You can pull me aside and ask me for details about that, but we do understand your anxiety. We respect that anxiety, and we want to make this as an easiest transition as possible. So for those of you that didn't see, we're going to do our rescheduled Dr. NAACLS for new program directors next week. We had to cancel in May because I had a last second conflict. Even if you aren't a new program director, there's a lot of good stuff to kind of maybe touch base with some basics that maybe you fell out of the habit with or just weren't aware of. So I encourage you to attend that. If not, have a good day. For those of you going to JAM, enjoy your conference next week, and we'll talk soon.
Excellent. Thanks, Mark. Thanks everybody for being here.